A patient 18 years of age with sebaceous cyst on scalp and back of neck, an osteoma on the right mandible. The radiograph reveals multiple impacted supernumerary teeth in both jaws. So these findings will suggest feature of Gardner syndrome. So in Gardner syndrome, what you will see is it is characterized by intestinal polyp as well as abnormality of the bone, teeth, skin, soft tissue and other sites. The Gardner syndrome, it is an autosomal dominant disorder that is caused by mutation in the APC tumor suppressor gene. Now, what are the clinical features of this Gardner syndrome? You will see a polyp, a colorectal polyp that are adenomatous. So lesions are asymptomatic. It may cause diarrhea, constipation, rectal bleeding, anemia and abdominal pain. So if these polyps are untreated, they will ultimately transform themselves into adenocarcinoma. Around 90% of patients with the Gardner syndrome will demonstrate skeletal abnormalities, the most common of which are the osteoma. These osteoma are noted around the puberty, and that may lead to early diagnosis of the Gardner syndrome. These osteoma may affect any part of skeleton, but they commonly involve the skull, paranasal sinus and mandible. So these osteoma appears as radiopasties that vary from few millimeter to several centimeter in diameter. Apart from that, you would see the dental anomalies that includes odontomas, supernumerary teeth and impacted teeth. So remember, the frequency of the supernumerary teeth in the Gardner syndrome is not nearly as high as that seen in the cleidocranial dysplasia. What are the other findings? Many patients will show cysts like epidermoid cyst of the skin. Other cutaneous findings may include lipomas, fibromas, neurofibromas and leiomyomas. So what is the treatment for the Gardner syndrome? Is the major problem for the patient with the Gardner syndrome is the high risk for transformation of colorectal polyp into the adenocarcinoma. So what we do is prophylactic colectomy. What are the dental managements? The dental management involves the surgical extraction of the impacted teeth, removal of the odontoma and prosthodontic treatment can be given. So this figure you can see a patient that has multiple large epidermoid cysts. He is having multiple large, these are the epidermoid cysts that are related to the Gardner syndrome. In this OPG you can see is these radiopasties like structures. These are the multiple osteomas of the jaw that are seen in the Gardner syndrome. So a patient with sebaceous cyst, osteoma, impacted supernumerary teeth in both the jaws will suggest which syndrome? Gardner syndrome is the answer.